In this work, we present a vaccination simulator for COVID-19 with effective and sterilizing immunization cases. This simulator is an extension of our previous work on particle-based SEIR simulator with contact tracing and testing modules. In this work, each individual is modeled as a particle that moves on a 2D map representing a certain area as shown on the box on the right, and get infected if they come to the infectious particle closer than a predefined physical distance or contact threshold in this context. Particles have following parameters such as location, velocity, epidemic state, time for being at the current epidemic state, availability of the contact tracing application, testing result, age group, and vaccination status. We added age differentiation to this model to account for the age-based fatality rate and to perform age-based vaccination cases. So here is the state chart of the model. We have 4 superstates: susceptible, exposed, infected, and recovered. The contact tracing module is based on the use of a mobile app, and it stores the list of contacts for each particle such that if a particle is determined to be infected, then all particles in the list are quarantined or isolated. The testing module simulates the massive random testing of the population. Since this work focuses on vaccination module, we removed the blocks and connections related to the testing and contact tracing module for the clarity of the presentation. Our simulator can model 2 cases of post-vaccination immunization, sterilizing and effective. In case of sterilizing immunity, immunized particles cannot get infected and transmit the virus to other individuals, while in the effective immunization, immunized particles can still get exposed to the infection and transmit the virus, but they have reduced probability of severe infection that might cause mortality. In both cases, the vaccination can be done in 2 stages to account for the practice of 2-dose COVID-19 vaccination. In case of sterilizing vaccination, particles from susceptible superstate, exposed, infected, and recovery immunized state are vaccinated. Susceptible vaccinated particles transition to vaccination immunized state based on the gamma immunization 1, which shows first dose efficacy of the vaccine when time T immunization 1 is reached. And to account for the second dose, the rest of the vaccinated particles transition to vaccination immunized state based on the gamma immunization 2 when time T immunization 2 is reached. The rest of the particles do not gain immunity and continue with the regular flow of the simulation. The vaccination immunized particles are considered to achieve sterilizing immunity, thus do not get infected and transmit the virus when they come in contact with contagious particles. For exposed, infected, and recovered particles, the vaccination is considered to be wasted. Similar to sterilizing immunization, in the effective immunization case, particles from susceptible superstate, exposed, infected, and recovery immunized states are vaccinated. For exposed, infected, and recovery immunized, vaccination is assumed to be wasted. In the effective vaccination case, there is no vaccination immunized state in the recovered superstate. Therefore, susceptible particles immunized by the vaccine are designated as vaccination immunized, but they may still get infected with less probability of getting severely infected from infected or isolated states. In addition to the vaccination module, our enhanced simulator features age-based differentiation of the particles. Therefore, we first performed model calibration and validation of our new simulator based on the statistics for the province of Lecca, Italy. We chose this region as it was the epicenter of COVID-19 outbreak in Italy, for which comprehensive epidemic data is available dating from February 24, 2020. The calibration simulation validates that our simulator can accurately replicate the effect of governmental policies on the epidemic dynamics of a certain region. In this demo video, we will show 4 different cases for province of Lecca: effective all, effective age-based, sterilizing all, and sterilizing age-based. We continue from the last day of the calibration model. The length of the simulation is 450 days, and the daily vaccines per 1,000 people is 2. So here is maps that are split based on the age groups from 0 to 80 plus. We have illustrated exposed, infected, severe infected, dead, and vaccination immunized states separately. Since we are starting from the last day of the calibration, we have already particles in each state. Small dots are the particles that are transitioned to the illustrated states before the start of the vaccination. Here is effective all case. Since we are vaccinating particles above 20, we see immediate increase of the particles in the vaccination immunized state. Further, number of severely infected particles and death increases for all the particles since they have higher SIR rates. As for infected and exposed, the number of particles across the age group are more or less even. Toward the end of 450-day period, we observed the end of the epidemic with a total death number of 3,371. Now, let's look at the effective age-based case. We are starting vaccination from older age group, which we see from the map of vaccination immunized. Particles start appearing consecutively in different age groups. In the age-based vaccination, we see that the number of infected and deaths are much smaller compared to the previous case, since particles with higher fatality rate are being immunized first. Age group 60 to 70 results in largest deaths because until the vaccination reaches them, a large number of particles in this age interval have already been infected. The total number of deaths in this case is 1,959, which is 40% smaller compared to effective old case. Now let's consider sterilizing immunization case. Here is a sterilizing all case. As previously, vaccination immunized appears simultaneously across the different age groups, and in this case, we observe much less exposed and infected as sterilizing immunized particles do not get infected and transmit the virus. Therefore, we see how the herd immunity starts working, and as a result, the number of deaths decreased to 1,797, which is 15% smaller to the effective age-based case. Still, the number of deaths in the older age groups is large since we are not prioritizing them. And here is a sterilizing age-based case, which shows the best performance. As we mentioned, for previous case, sterilizing immunized particles are excluded in the chain of infection spread, therefore the effect of herd immunity is clear. Moreover, vaccination is started from the oldest age groups, which results in significant decrease in mortality. The total death number is 1,702. Overall, the particle maps clearly show the dynamic of the epidemic across the age groups and epidemic states. This tool can be useful in the analysis of the trend of different vaccination strategies in defining the optimal approach for suppressing the epidemic with both pharmaceutical and non-pharmaceutical interventions.